From the PEP Radio Newsroom, this is the hourly news blast. 17 Democratic officials accuse President Donald Trump's administration of unlawfully intimidating healthcare providers into stopping gender-affirming care for transgender youth in a lawsuit filed Friday. The complaint comes after a month in which at least 8 major hospitals and hospital systems, all in states where the care is allowed under state law, announced they were stopping or restricting the care. The latest announcement came Thursday from UI Health in Chicago. Trump's administration announced in July that it was sending subpoenas to providers and focusing on investigating them for fraud. It later boasted in a news release that hospitals are halting treatments. The Democratic officials say Trump's policies are an attempt to impose a nationwide ban on the treatment for people under 19, and that's unlawful because there's no federal statute that bans providing the care to minors. The suit was filed by attorneys general from 15 states and the District of Columbia, plus the governor of Pennsylvania, Gov Shapiro, in U.S. District Court in Boston. The federal government is running a cruel and targeted harassment campaign against providers who offer lawful life-saving care to children, New York Attorney General Letitia James said in a statement. Trump and others who oppose the care say that it makes permanent changes that people who receive it could come to regret, and maintain that it's being driven by questionable science. Since 2021, 28 states with Republican-controlled legislatures have adopted policies to ban or restrict gender-affirming care for minors. In June, the U.S. Supreme Court ruled that states have a right to enforce those laws. That was in the case of U.S. v. Scrimeti. For families with transgender children, the state laws and medical center policy changes have sparked urgent scrambles for treatment. The Center for Trans Youth Health and Development at Children's Hospital in Los Angeles, the biggest public provider of gender-affirming care for children and teens in the United States, closed in July. At least 7 other major hospitals and health systems have made similar announcements, including Children's National in Washington, D.C., University of Chicago Medicine, Yale New Haven Health, and UPMC in Pennsylvania. Kaiser Permanente, which operates in California and several other states, said it would pause gender-affirming surgeries for those under 19 as of the end of August, but would continue hormone therapy. Connecticut Children's Medical Center cited an increasingly complex and evolving landscape for winding down care. Other hospitals, including Penn State, had already made similar decisions since Trump returned to office in January. Alex Sheldon, executive director of GLMA, an organization that advocates for healthcare equity for LGBTQ plus people, said the health systems have pulled back the services for legal reasons, not medical ones. Not once has a hospital said they are ending care because it is not medically sound, Sheldon said. Trump devoted a lot of attention to transgender people in his campaign last year as part of a growing pushback from conservatives, as transgender people have gained visibility and acceptance on some fronts. Trump criticized gender-affirming care, transgender women in women's sports, and transgender women's use of women's facilities, such as restrooms. On his inauguration day in January, Trump signed an executive order defining the sexes as only male and female for government purposes, setting the tone for a cascade of actions that affect transgender people. About a week later, Trump called to stop using federal money, including from Medicaid, for gender-affirming care for those under 19. About half of U.S. adults approve of Trump's handling of transgender issues, according to an AP NORC poll. But the American Medical Association says that gender is on a spectrum, and the group opposes policies that restrict access to gender-affirming health care. Gender-affirming care includes a range of medical and mental health services to support a person's gender identity, including when it's different from the sex they were assigned at birth. It includes counseling and treatment with medications that block puberty and hormone therapy to produce physical changes, as well as surgery, which is rare for minors. In March, a judge paused enforcement of the ban on government spending for care. That's the news blast for this hour. Tune in tomorrow and Sunday for Stand With Pride, a weekly review of the news impacting the LGBTQ plus community. You can now listen to PEP Radio on Roku, the PEP Radio page at paequality.com, the Live 365 app, and on Alexa. Simply tell your device, Alexa, play PEP Radio. Up next, we have the Meadville area weather forecast here on PEP Radio.